Steve Moran here with Senior Living Foresight. I don't know, excited is exactly the right word, James, but this is a really important topic. And so I'm glad you were able to join me to talk about, really, we're talking about the peril that senior living is in. But before we get started, I've got a little intro clip I have got to play. Welcome to Foresight TV, where we provide leadership food for the soul, helping senior living organizations have higher occupancy, lower turnover, and better cultures. Today's episode is made possible through the generous support of Connected Living, a technology company that helps senior living communities effectively communicate with residents, families, and team members. Here's today's show. So, James, thank you for joining me. You are the president, CEO of Argentum, which is the trade show that represents the trade association that represents primarily, but not exclusively, not-for-profit or for-profit senior living operators. And why don't we actually just start with kind of talking about where the industry is with occupancy and COVID and PPE and expenses and all that kind of thing.
Sure. And thanks for having me, Steve. And yeah, we represent independent living, assisted living, memory care, continuing care communities, for-profit, not-for-profit, just sort of anyone within that, when you think about the long-term care continuum, that middle spectrum, with skilled nursing on one end and home care on the other. We're sort of in the middle. Really, it's been a challenging environment over the last 12, 14 months for our communities. As you know, the crisis started early last year on the West Coast, and we've all seen what it's done. But the impact on our communities was really almost immediate. In terms of, and to their credit, I think it was because they were making many of the right decisions in terms of restricting visitation when we saw where the virus was going. I always use this as one example, but in the earliest days when the virus was in Washington state, and I think we all remember that, we had a provider that was closing their communities to visitation right then, but they were also doing it in their communities on the East Coast, and families and residents were still in the early days questioning why they were doing it, and I think they're all grateful now. But the battle with COVID is far from over, and certainly we've seen significant expenses associated with keeping our residents safe through PPE and hero pay and testing that our providers have had to pay for, but also the impact of occupancy has been significant on the industry and continues to be. And I think we've all been watching those occupancy numbers over the last year as we've restricted new move-ins. And we've seen the impact. Assisted living now, I think the average national occupancy is down to 77%. And that's really, you've got providers that are below that, well below that in certain markets. And so that's certainly having an impact, financial impact on our communities, which long-term could impact the whole long-term care sector and our ability as a country to care for our seniors. And so that's what we're really focused on and have been really for the last 14 months has been making sure that our communities get access to not financial relief, but also other resources and supports, vaccinations, testing, PPE, and so on.
So as I look at the marketplace, and maybe you see it differently, but as I sort of look at the senior care marketplace, you described already that nursing home is sort of at one end of the spectrum. And it feels like they've gotten, I don't want to say they've gotten more than their fair share, because I think that they would push back and say they've gotten what they need or almost what they need. But it seems like they have gotten a lot more relief than the rest of the senior living sector. Is that a fair assessment?
Oh, yeah, I think so. And I think there's a few reasons for that. I mean, our industry we're predominantly a private pay industry, right? So our residents who certainly need the services we provide, they ultimately choose the communities that they're going to move into, and the residents pay for those services or their family members, some combination therein. And so being predominantly private pay as an industry, we have sort of not really been a focus or a priority, certainly for the federal government. And so in the midst of a crisis, as they're thinking about where they need to allocate resources, logically they go to nursing homes, which is, you know, Medicaid and Medicare reimbursed essentially. They do have some private pay, but predominantly they're reimbursed through the government. And so that's really where a lot of the earliest support was going to skilled nursing facilities. So a lot of what we've had to do, and quite honestly, you know, the other national associations have had to do, is spend a significant amount of time educating lawmakers, the prior administration, on what senior living is, who we care for. And I think they've, you know, there've been a couple of different types of misperceptions about our industry that we've identified. Sometimes policymakers will think that they've supported us when they've been supporting nursing homes, which they haven't. And then on the other end, I always go to spectrums. On the other end of the spectrum, you have folks that just didn't really understand what it was we do. And I use this quote as something we got back, but our communities are places that people go to when they don't want to cut their grass anymore. And that's just, you know, a complete misunderstanding of the residents that we serve and the services that we provide. And so we've had to educate lawmakers on really both of those challenges throughout this crisis, and ultimately have started to gain some understanding. And we're ultimately able to get our communities opened up to access the Provider Relief Fund through HHS, which is where a lot of the funds for skilled nursing was flowing. But unfortunately, it was too little, too late. Quite honestly, that financial relief actually didn't start coming to our communities until fall of last year, and so far, I think we've had about $1 billion that's been made available to our communities. But when you think about the entire Provider Relief Fund of over $170 billion, there's a significant gap there, a shortfall in what our communities ultimately need.
So do you have a sense of what it would take to, I don't want to be too dire, but my sense is there are a number of organizations, large and small, that are potentially on life support, who frankly probably would be already gone if it weren't for their capital providers, their capital partners, who've generally done an amazing job of working with communities. Let's start with how bad. Two questions really. You know, how perilous is the industry situation right now, and how much money would it really take to sort of get us back to a reasonable? I mean, nobody would expect us to get back to healthy, right? And, you know, making lots of money, but at least to some place where people can provide care comfortably without sweating it every night when they go to bed.
That's a great question. And as I've been talking to many of our providers, and you know, go back to the occupancy challenge we've had, just generally speaking, when you think about sort of 80% occupancy, that's and it'll vary market to market, provider to provider, but that's a good sort of measure of when to think about providers operating at a loss, right? And so now we're well below that 80% threshold. And we did a survey, and ACA and Cal did a survey as well, showing that about 50% of providers are currently operating at a loss, and almost 60% of providers are concerned about their ability to keep their doors open over the coming year. And again, this, you know, there's light at the end of the tunnel in terms of vaccines being made available, certainly to our residents and to team members and the country as a whole. But our financial challenges compound month over month with these occupancy challenges, and so it's going to be a while before we're able to get out of it. And really, when we took a look at the financial impact over just last year related to COVID, we that it was about over $15 billion in losses for our industry related to increased expenses and lost revenue because of those occupancy challenges. And certainly would love to see that level of support, and certainly think that our communities have earned it. I think our providers, and as you mentioned, the capital partners have been keeping our residents and team members safe as possible throughout this crisis at tremendous expense. But we've been we recognize that there are other healthcare sectors that need support. And so we've been pushing for recently $15 billion in targeted funding specifically for senior living, either through the Provider Relief Fund or through some other measure, a legislative approach up on the Hill.
So do you think that has it changed with the change in administration? Do you feel like more supportive under the new administration? It's going to be easier to make that happen?
We were optimistic that we were going to be able to work with the administration, and still are. It's still early to tell, right? They're still getting the right people in place at HHS and so on. So I'm still optimistic that we're going to be able to work with them. We are, honestly disappointed in the current legislative package that's been put forward. When you think about a $1.9 trillion legislative package that mentions long-term care once and sets aside $1.8 billion for long-term care alongside with other congregate settings like prisons, that's disappointing to say the least. I think this legislative package was really designed to focus a lot on education and some other needs related to labor and workforce. But we really need to make sure that our long-term care facilities, any long-term care facility for that matter, whether it's skilled nursing, assisted living, independent living, memory care, continuing care, you name it, is getting access to resources to make it through this crisis. And so, we continue to push for incremental dollars to be put into that legislative package. Part of the challenge is, Congress decided to move forward through a process called reconciliation, which means that in the Senate, they simply need a majority to pass it. But there are certain rules, arcane rules that go along with that, that restrict the ability to put incremental dollars or make changes to other allocations that have been put forward previously. We still, are working to push past some of those challenges, but it has made it difficult.
So, as you're talking about this package and a little bit of money, I was at Best Buy. I needed to buy a new TV for a guest room. And as we were talking to the salespeople, they were sort of overhearing their conversation. They were talking about how busy it was about to get at Best Buy because of all the stimulus money that was about to come. And I'm kind of thinking, maybe some of that money ought to be going to people who really need it, because we're talking about frontline workers and our residents. And rather than giving people money so they can go buy new TVs and new tablets at Best Buy, which, they know that that's coming. And so it suggests that maybe the priority is a little bit wrong. So I want to actually hit fairly hard two really critical, important things. Is the first I want to talk about is how do providers access this money? Is there some sense that maybe they're not doing as good a job of doing what they need to do to make sure they can access this money? And the second thing is, I think I want to spend some time on is how do we as leaders in the community, as frontline workers in the community, what do we do to bring pressure on the government to give us fair consideration? So let's actually start with just the process of getting access. I mean, do you feel like people are doing a pretty good job, or is that a struggle?
No, I think our providers have done a good job in terms of trying to access the funds. I think there's been a bit of a logjam in actually making the funds available. So the Provider Relief Fund, which was originally put together through the CARES Act, and then incremental dollars were added subsequently. It's managed through HHS as the Provider Relief Fund. And any eligible healthcare provider can apply. And so our communities last September were ultimately designated to be able to apply as part of a phase 2 distribution. And so what that meant was our providers needed to go in and actually apply and provide information, including tax information, and get approved for payment, and then set up an account so that funds could be put into their bank account. That's generally very generalized way of how it works.
Right.
And subsequently, there was, and that was intended to be 2% of gross patient revenue, just to be sort of a stopgap measure. And we still have providers that went through that process, but have yet to receive any of that funding from back in September.
Wow.
Yeah. And then there was a subsequent phase, what they called a phase 3, which was really taking a look at your COVID-related expenses and lost revenue. And that was intended to cover that financial impact for the first and second quarter of last year. And so again, providers would go in, provide information, tax information, expense, revenue loss information, an actual application process, and then ultimately get approved and then get funding. And that's the piece that we are still in the process of. They haven't distributed all of those funds. We think that their intent at this point is to have most of that phase 3 funding out by the middle of March. But it's been very slow. Now, of course, we've had an administration transition in the middle of that, which is certainly understandable. But still, these are financial resources that our providers ultimately need to get access to. And really, they need to get access to yesterday, just because of the financial challenges that they're under. And so when we talk about additional financial dollars, we're only working our way through the first half of last year related to the impact. And we all know that the third and fourth quarter were where we saw the COVID surge, were much more impactful for our industry, just as the first and second quarter of this year will be much more impactful. And that's why we need to make sure that additional dollars go into the Provider Relief Fund, or targeted funding is specifically made available for our communities on a go-forward basis. To your second question about how can the industry engage and ultimately sort of push lawmakers in the direction they need to go, that's a great one. And I think, I have not seen in my 20 plus years as working for different associations, I have not seen an industry come together the way ours has throughout this crisis. And I don't even mean just from a public policy perspective, but just the willingness of our communities to collaborate and share best practices, share resources. The earliest days, sharing PPE with each other as they needed to, as everybody was scrambling to try to find access to it. It's just been incredibly heartwarming to watch and witness. But now we all need to come together and actively make our voices heard about our need for financial relief as an industry. And I think people can reach out and most of their national associations will have a similar platform. Ours is called Standing with Seniors, and people can leverage our Standing with Seniors campaign to actually go online, visit standingwithseniors.org, and you can send a letter to your elected officials advocating for the need for financial resources and support for our communities. And I think that's going to be the most effective way for our industry to come together and try to push this forward.
So, and we've got some links that we'll put up right after the video's over so people can access that. But I also find myself wondering, I don't know whether anybody has done that. We talked a little, I gave you some questions in advance and we were sort of laughing that I'd probably throw something at you because I hadn't thought about it before. But wouldn't it be interesting if some of the senior living communities actually did some telethons to call their state representatives and their senators and make calls with both residents and even with team members and say, hey, help us out. It would seem like those are the kinds of grassroots things that could make a huge difference.
Oh, and they do. And quite honestly, that's, who policymakers want to hear from are their constituents, right? Voters. And there's no better place to connect with voters, quite honestly, than in our communities, right? I mean, it's a very active block of voters living in every single one of our buildings. One of the things we did early on and continue to do and have had success with, tens of thousands of letters have gone to Congress from residents and family members. And ironically, when we took a look at it, when we launched our Standing with Seniors campaign and we asked our communities to encourage residents and family members to engage in this way, it was family members that were most active. Residents did it too, but by and large, it was family members that were engaging much more in terms of sending letters, making calls to their elected officials. But that's an incredibly powerful way to get our message forward. These are the residents that live in the buildings that need the support. And quite honestly, if we've got about 2 million residents living in our communities, if the private pay senior living market were to go away tomorrow as a result of COVID, not that it will, but if it were to, that's 2 million seniors that are going to need somebody to care for them. And I don't think Medicaid is equipped to deal with an additional 2 million seniors. And so it's really critical that the private pay market, which saves billions of dollars out of our social safety net, continues to be a viable option as a part of the long-term care continuum moving forward.
Yeah, I think it's so important. I so often hear, some disparagement about private pay and for-profit ownership, but today they do the bulk, by a huge margin. They do the bulk of the care of our older people in our country, and that gets missed, and it's such an important topic. So we're going to put some resources in. It would be so cool. I've already got this story that I want to do for somebody. If somebody does like a telethon in their community with their residents, take a little bit of video. We'll go out and promote it. And maybe what we need is like video. We need telethon Fridays or telethon Tuesdays. That sort of sounds better, right? Where they organize this thing. It would be pretty cool to do. So we've sort of talked about where do we go from here? Where does the industry go from here? Are you hopeful? Are we just in this forever? Do you have a sense of when the recovery is going to be? Are you seeing already some improvement in occupancy, that kind of thing?
Great question. Depending upon who you talk to, you get all sorts of different answers on when recovery, we'll start to see recovery. I'll start by saying, we know there's pent up demand. And there's been some research that's taken a look at that. And ASHA recently did some research that took a look at consumer perceptions of senior living, and they have not drastically changed. We also know in a positive way. And we also know that generally speaking, residents and family members have been pleased with the level of service and they've received throughout the crisis, even when you had to go into a sort of a quarantine mode. So I think the outlook for the industry is still incredibly positive long term, and you certainly have the demographics there that are going to support the industry. The question is ultimately, is it months, a year and a half? How long does it take for us to come out of sort of the COVID hangover? And we know COVID's going to be with us for a while. Vaccines are certainly going to sort of get through the broader community throughout the summer and perhaps into the fall. But by then, hopefully most everybody will have been vaccinated. But there's already talk about continuing to wear masks into next year, and certainly concerns that there could continue to be flare-ups of COVID over the next several years, not unlike the flu. And so I think this is going to be a new reality that we're going to have to live with. But our residents are people that need, as I said earlier, services and supports, but they're also looking for socialization. And a lot of people talk about, the need for aging in place, and that certainly may be appropriate for some people, but for a lot of people, aging in place means aging alone. And I think that's really a critical part of what our communities provide. And again, that's why we need the financial support now to make sure that we're a part of the long-term care continuum moving forward.
So what are the lessons? I want to encourage people to really take action on this, but I want to sort of move beyond that a little bit. What are the lessons that you think that we have learned as an industry out of COVID? How will it make us better going forward?
That's a good question, and we had a conversation with some of our providers a little while ago about this. I think there's certainly going to be some changes in terms of infection prevention and control. I think folks are taking a look at that differently than they have before. You're hearing talk about changes to air quality systems. I think we're certainly going to see telehealth continue to be more prevalent in our buildings than it ever was before, and probably continue to grow in terms of utilization in our buildings. I think the fundamentals, though, of what we provide, I mean, it's a hands-on business, right? When you think about helping somebody get out of bed, helping somebody dress, helping somebody bathe, all of that is a hands-on business. Technology isn't going to change that. And so those infection prevention and control protocols are going to be critical moving forward. But I think our communities have had those in place for years and years. We've dealt with the flu forever. This was just a virus that nobody expected and spread in a way that nobody was quite prepared to. And actually, when you take a look at the spread of the virus, I mean, ultimately, communities that were impacted, the broader community around their buildings was impacted, right? And I think that's something we've got to all keep in mind.
Yeah. So we've had several comments, and I want to touch a few of them before we're done. So, are you seeing any differences between rural and urban areas in terms of shortfalls, and are there some states that are better than others?
That's always a tricky question. The one thing that's been interesting with COVID is it has varied, right? From region to region in terms of when you're impacted. It started on the West Coast, but then you had the Northeast that was, on a parallel path to being dramatically impacted. It shifted to the South and then the Midwest. So it's moved from region to region. And I think that has been a part of the challenge. Fortunately, unfortunately, early on, we were all struggling with access to PPE and certainly testing. But months into the crisis, I think that got much better. And I don't hear about concerns around PPE as much as we did before. I think it's still top of mind for our providers in terms of, making sure that they're going to have a long-term supply of it, or access to a long-term supply of it. And then it was testing. Testing was sort of the next big challenge. How do I get access to effective testing? How do I pay for effective testing? And quite honestly, our providers were stepping up early on in many cases and just paying for the testing themselves once they could find supply to it. And then ultimately, we were able to get our communities access to it, to the Buy Next Now test through HHS. And then now we're into vaccines. So it's really been, it's been based upon where COVID has spread and where the surge has been that I think has really impacted a lot of those issues.
Great. So couple comments here I don't quite understand. Quick comment about, do you feel like there needs to be better guidance and leadership coming at the federal and state levels as leaders confront the shortfall deficit placing the industry and its caregiver and resident? I mean, one of the things I think we haven't talked about too much, but that I know is really front and center for you as a leader and for Argentum and for the operators is not having enough money puts frontline caregivers at jeopardy, and there are essentially as many workers in the senior living community typically as there are residents. So you're talking about a really big number of people who are being impacted.
That's a great point, and we shouldn't forget those that are on the front lines. And I know it's been hard. I'll be honest, for some of our providers and our caregivers. Particularly early on when you were seeing hospitals recognizing heroes work here, and certainly our communities were recognizing that heroes work there. But the broader media just didn't quite seem to understand that and capture that. And I know that's been frustrating for our team members around the country. And I think they are the heroes of this story. I mean, nobody is at risk for COVID-19 like our residents are, right? Or skilled nursing patients for that matter. But I mean, just average age of 85, multiple chronic conditions, severely at risk for COVID-19. And our caregivers have been there day in and day out, doing everything they can to keep them safe. And that's why we need the resources to keep our caregivers safe, right? We need the financial support so that we can continue to provide hero pay, continue to provide some of the resources that we have been providing. I talked to providers early on that were making transportation available, making groceries available so people wouldn't have to stop at the grocery store on the way home. They could just take some groceries from the community and go home and be with their families. And so we need the resources to continue to be able to provide that support. And it's not just financial, right? It's the testing needs to continue. The vaccinations need to continue even once we're through the 3 clinics that we're currently going through with the federal partnership for long-term care, pharmacy partnership for long-term care. We need to make sure that vaccines continue to flow into our communities for our team members then as well.
Yeah, and I think the other thing for me is when I look at it is that, if operators are operating at the edge or they're just barely there and they get, they run on this life support, they don't make as good of decisions in terms of, and they can't do as good a job of caring for residents and team members. And this is really a critical problem. So I guess the big thing I would say is we just need to be putting as much pressure on as we can. We need to take that extra mile. It's easy for people to think somebody else can do it or it doesn't make any difference. But the truth of the matter is, our politicians pay attention, and when they get pressure, they go, "Oh yeah, maybe I better do something about that." So, well, there's one more question I'm going to touch. Any sense? I mean, are people having to replace heating and air conditionings? I assume whoever wrote that has a specific interest in that area. But are you seeing air filtration being a big issue?
Yeah, I couldn't speak to how many are replacing versus have sufficient systems in place already, but I know our providers have been taking a look at that, and I know they're thinking about that. One provider recently, it's not air filtration systems, but was putting in a sort of a UV lighting system so when you walk in the door, you're sort of eliminating viruses before they actually get into the building. So I know they're taking a look at all sorts of different technologies to ultimately figure out how to reduce the potential spread of the virus, and air systems are certainly going to be a part of that. I think a lot of our communities already have effective systems in place, though.
Great. So did I miss anything that we should be talking about, or any last words of wisdom you want to give before since we're about out of time?
Just, engage, reach out to your policymakers because that's going to be the most effective way to get our communities and our team members the resources they need.
Perfect. James, thank you very much. If you stay on for just a second, I'm going to shut the broadcast off. Thank you for watching.
Thanks, Steve.